So these are the postpartum instructions. They'll go over what you should expect in the postpartum period for yourself and also for your new baby, and also things to look out for and when you should contact your midwife. So after birth, you will have bleeding. This bleeding comes from your uterus, and you may also continue to have contractions. And this is the body's way to make the uterus contract down and keep it hard, and it reduces the amount of bleeding you're experiencing. It can be painful. To minimize the pain, making sure you do want to stay well hydrated, but you also want to keep your bladder empty. You can try a calcium magnesium supplement or an anti-cramp tincture. Um, if your uterus is not feeling very hard, you can kind of give it a massage, and this should make it cramp up a little bit, but it can keep the bleeding down, which is important. You can take 800 milligrams of ibuprofen every 8 hours, or 1,000 milligrams of acetaminophen, which is Tylenol, every 8 hours. And you can alternate taking these every 4 hours so that every 4 hours you're taking something. And again, keeping your bladder empty will also help reduce those after pains and keep your bleeding down. If you're still having, a lot of pain with this and you've tried these suggestions and it's intolerable, then you'd want to reach out to your midwife. So it's really important that you're keeping an eye on your bleeding after you've had a baby, especially in the first 24 hours. A delayed hemorrhage is a lot less common, but it is still possible. Your bleeding should be like a heavy period for the first few days, and after that, the amount should lessen and the color will actually change, brownish, pinkish, and eventually even clear white. Having clots is normal. Small clots is what you're going to want to see, but if you're seeing a big clot the size of a large chicken egg, you'd want to call your midwife. Make sure that you're using a pad only. You don't want to insert anything into the vagina. As your bleeding tapers off, if you see a sudden increase again in that bleeding, it may be because you're kind of overexerting yourself. So kind of examine what you've done that day and maybe reduce some of that activity. But if you ever bleed through a pad in more than an hour, or it depends, you're going to want to make sure that you call the midwife as well. So when you're using the restroom after you've had a baby, the first couple days there can be some stinging. This could be regardless if you've needed stitches or not. Something that can help is using a peri bottle. It also helps to rinse off after using the restroom. If you've had stitches, you shouldn't soak in a bath because this can speed up the healing of the stitches. However, if you take a short sitz bath, like in an herbal tea, you can do that for about 10 minutes a day, and that's fine. And the soreness may last for a few weeks, but it shouldn't be extremely painful. The stitches, if you did get them, they dissolve on their own. There's no need for them to be taken out. As sutures begin to heal, or if you've had any tearing, sometimes there can be itching. You need to make sure that you avoid scratching it can aggravate the healing. And it's best to try to minimize too much physical activity. That doesn't mean not doing anything, but definitely take it easy and evaluate your body and listen to your body. If you decided to not have sutures, it's really good to practice when you're getting in and out of a bed or a car that you're kind of keeping your legs together and trying to keep that perineum from opening back up. It can kind of be uncomfortable to have your first bowel movement. Sometimes taking a warm cloth and holding it on your perineum as you're trying to relieve yourself can really help bring some comfort and make it feel like nothing's falling out anymore. Keeping up with a healthy diet and making sure that you're getting good fiber can also keep you from getting constipated, and that can make your bowel movement more comfortable. Proper nutrition is really going to help as well to avoid any constipation and that would make it more uncomfortable. If you have stitches, make sure that you're keeping them clean and dry. Any perineum soreness, a cold frozen pad can be comfortable. You can use witch hazel on that pad. This can kind of take down some of the swelling, and the witch hazel is beneficial for the healing. Make sure that you're not using witch hazel that has alcohol in it because that can burn. If you smell any foul odor, or any area around the vagina or in the vagina is looking red, or it's really warm to the touch, or if you have a fever, this could indicate an infection and you should call your midwife. So your milk usually doesn't come in till around day 2 to day 5. In the meantime, while you're waiting for your milk to come in, you will be producing what's called colostrum, and this is enough for your baby, and there's no need to supplement until you're waiting for your milk to come in. When your milk does come in, you might feel this full filling in your breast or chest. This is called engorgement, and it can be kind of painful. And if you're needing relief from this, you can use a warm water or like a hot pack or get in the shower and massage your breast or chest with your hand while you hand express milk. And this can kind of relieve some of that fullness. You want to make sure you only express enough to feel comfortable. Otherwise, you might cause more pain with increasing extra milk than your baby needs. Your nipples might feel a little sore, but it shouldn't be painful to feed your baby when they latch. If there's pain, that could be a sign that the latch isn't correct. And if you're feeling discomfort, it's always best to unlatch and evaluate what's going on and try to latch in a different position. And if you're needing further assistance with latching or having pain, you can always reach out to the midwife. Also, if you're struggling with nursing without pain, or if you notice any redness or heat or lumps in the breast or chest, or if you're having a fever, you need to reach out to the midwife. Having a new baby can bring on a lot of new emotions, especially when they're so young. This postpartum period can also be a time where the emotions you do experience can be really intense. It can also come with a wide range of emotions, from happiness to anger, sadness, gloom. It's really normal to feel a big rush of emotions or feel like more weepy than usual, especially when your milk is coming in and the hormones are balancing in your body. This sudden change is usually called what's called baby blues, and this doesn't mean you're getting postpartum depression. But if you do see any signs of postpartum depression or postpartum psychosis, then this is something where you would need to reach out to the midwife. This can be like really prolonged depression, thoughts of harming the baby or yourself. If you're feeling really big, dangerous emotions, please do reach out. If you have a history of depression or anxiety, you may be more likely to experience that. So that's something to keep an eye out for. But please do make sure that you call immediately and reach out because these things can be treatable. Overall, after birth, it's normal to feel tired. It's normal to feel like a little bit of soreness with your muscles. But overall, you shouldn't feel like you're getting sick or feel like overly achy, especially having pain in your legs. If you're experiencing any pain in your legs, or maybe you have like a hot, red, hard, or swollen area in your leg, you would definitely want to reach out to your midwife immediately. Also, if you're feeling achy, feel like you're coming down with a cold or a fever, or you have like a painful headache, and with any like visual disturbances, if you have nausea or vomiting or any pain in your upper right abdomen, then this would be a sign you need to call your midwife as well. So if you experience anything else that wasn't discussed when it comes to you during the postpartum period, this would be a time where you'd want to reach out to your midwife and ask any of those questions. I'm going to go over a little bit to what to expect more specifically with the baby in the postpartum period. And again, if you have any other questions, always reach out to your midwife. So if you're ever wondering if baby's too cold, you can take baby's temperature. This kind of lists some of the vitals that are normal for baby. And if baby ever fell outside of these normal vitals, you would want to give the midwife a call. Babies, when they breathe, they can kind of breathe like little puppies, and they'll pant really fast, like, and then they'll take these big pauses and stop breathing. And these pauses they take is called apnea. And this is normal for babies to have 5 seconds of apnea. If it takes any longer than that, you're going to want to take the baby to be evaluated and give the midwife a call. If a baby is breathing and you're not kind of sure, something you can kind of do if you're not sure, or even just to pay attention, like during diaper changes, is to look at how baby's breathing by taking a look at baby's ribs. And when baby breathes in, if you see the skin sucking into the ribs, that's called retracting. That would be a sign that something's not right, and you'd want to call the midwife and have the baby evaluated. As well, if baby's breathing and they're having grunting or their nostrils are flaring. Babies should never be blue around the mouth or inside the gums or in the trunk of the body. Sometimes blue hands and feet are normal, but if you see it in those other places, take the baby to the nearest emergency room and call the midwife. So, we talked a little bit about what it's like when your milk's coming in and what that experience is like for you. But something to know that's good is like the first 24 hours, babies are going to kind of be sleepy a lot, but it's still good to try to nurse them as much as possible. Babies can usually take a good 4 to 6 hour nap right after birth. And then after that, you're going to want to try to be feeding baby every 2 to 3 hours around the clock. It's normal for babies who are brand new to have like a 3 to 5 hour sleep once in a 24-hour period. But other than that, you're going to really want to make sure baby's eating at least every 2 to 3 hours. And the most important thing is to look for hunger cues before a baby cries. These cues can be like bringing their hands to their mouth or rooting around or sticking their tongue out, sucking on their fingers. Those are signs that you want to feed the baby. And this can really help establish your milk supply. And so if you are not seeing baby showing a lot of signs of hunger and baby's like really sleepy, not really waking up, hard to nurse, or seems like super drowsy or lethargic, you're going to want to call your midwife right away. So, baby in the first 24 hours should at least have one poop and one pee. And then after that, baby should be having 6 to 8 wet diapers a day at the minimum and at least 1 to 3 poops a day. Um, it might be normal to see little orange crystals in the urine in the diaper, and this is normal. It just might be a sign that baby is dehydrated. So, increasing your water intake or hydration through tea and nursing more often can help get rid of those crystals that you might be seeing in baby's diaper. Baby's first poops are going to be really black and tarry and thick. It can kind of help to keep a little bit of like something like coconut oil or olive oil on baby's booty. This will make that black tarry poop come off a lot easier. As your milk comes in, you're going to see that the poop will change in color. To this will change to green, and then after a little bit, you might even see like yellow, seedy looking mustard poop. And this is really normal. Babies shouldn't have any mucus or blood in their poop. That would be a sign that you'd want to make sure you reach out and call the midwife. If baby hasn't peed or pooped at least once in the first 24 hours or isn't meeting the guidelines of 6 to 8 wet diapers or at least 1 to 3 poops, then you'd want to reach out to your midwife as well. So the umbilical cord is going to be really important as it's healing to keep it out of the diaper so that it can stay really dry and really clean. This will help the healing process. Usually the cord falls off around day 5 to day 10. With keeping it dry, you're going to want to make sure you're not submerging baby in a bath until it's completely fallen off and healed all the way. It can kind of get a little smelly, but it shouldn't smell foul. So if you're having red around the umbilical cord, or pussing, oozing, or any signs of infection, or it's staying wet all the time, you're going to want to make sure you call the midwife. Like we discussed earlier, babies shouldn't be blue in the trunk or around the mouth or in their gums. Generally, babies who are lighter skin tone should be pinkish, and then maybe darker skin tone babies are going to have more red undertones. This would be normal. Babies can also have birthmarks that start or spots that develop over the first few days of life. But if you're ever concerned with new spots or things on their skin, you can call the midwife. What is normal is you can have like almost like baby acne. Their skin can get really dry and flake and peel. That's normal. Little white spots on their faces are normal. Also, the little coating on their skin that's white, that's called pharynx. You don't need to remove that. Babies' bodies will actually just absorb it, and it's really good for them. If you do see baby's skin is dry and peeling, it's really good to avoid using any lotions and just let baby kind of flake that skin off, and then baby will be able to produce their own skin oils much more efficiently. If you are seeing any blue trunk or blue around the mouth, call the midwife immediately. Blue hands and feet are kind of normal the first few days of life. If there's anything on their skin that looks like it could be infected, like it's red, hot, swollen, or any other abnormal reactions, make sure you call the midwife. There's a condition called jaundice. This is where the baby's skin can look yellow and you can have yellowing of the eyes. This isn't normal in the first 24 hours. So if it were to develop in the next 24 hours, you'd want to make sure you call the midwife. Normal jaundice can occur around day to 3 to 5 is when it usually occurs. Um, and a way to help with baby is to kind of like give baby some sunlight, 5 to 10 minutes a couple times a day. You want to make sure that sunlight isn't direct sunlight because babies can get a sunburn. Jaundice kind of moves from head to toe. And so we'll start at the head. It'll work its way down the trunk and then out to the extremities. If you're noticing babies, jaundice has reached their nipple line, you're going to want to take them in to get evaluated and make sure you reach out to the midwife. So babies can be born with really long fingernails sometimes. It's okay to file them, trim them, nibble them off, or whatever you feel comfortable with. A baby's eyes can also get what's called a plug duct. If baby's getting a plug duct, you can kind of release this by like using a warm cloth and kind of wiping baby, putting your finger in the corner of baby's eye and the inside and rubbing up and down. Try to avoid rubbing side to side on baby's eye because you can kind of spread anything around there and kind of get it clogged more. If baby's having any like green or yellow discharge, especially after sleeping and baby's eyes getting crusted together, you're going to want to make sure you reach out to the midwife because this can be a sign of a little bit infection in baby's eye. Babies can also have little bloodshot eyes. This is normal the first few days after birth, but it should begin to improve. If it doesn't show improvement, reach out to the midwife. Also, babies can have crossed or wandering eyes, and this is normal for a newborn as well. But if you see any signs of infection, please reach out to the midwife. So it's good whether you are GBS positive or negative, or if you've had prophylactic antibiotic treatment during labor, you should always be on the lookout for signs of infection. Generally, babies should be alert and responsive, and they should be able to be woken up like when you change their clothes or change their diaper. If baby's not waking up, that would be a sign of concern, and you'd want to reach out to your midwife. Again, babies should generally be pink or red undertoned all over their body, and they shouldn't look like they're in serious discomfort and pain. So if they are, reach out to your midwife. Um, a sign of infection in a baby can look two different ways. One, baby can be very lethargic, and again, hard to arouse. The other, baby could be like overly fussy or really irritable, have like a high pitched scream. These would be signs, and like really unconsolable. And this would be a sign of baby struggling. Baby could also look like really dusky in color or have labored breathing or a fever. So if anything like that happens, you'd want to take your baby to the emergency room and call the midwife. Babies born with a female genitalia, they may have bloody vaginal discharge, and all babies could actually develop enlarged breasts, and this is just due to hormone changes within or from the birth and from breast and chest feeding. But if you see anything abnormal, any lumps or things that look different, please reach out with any questions you have. This is a lot of information to go over, and if you need any assistance at all, we would rather you reach out than not.